Hi, my name is Ken McMahon. I'm a doctor of physical therapy with Rehab, etc. Physical therapy. And today I'm going to talk to you a little bit about myofascial trigger points. Now, first thing we need to do is just describe what is a myofascial trigger point. To use an example here, we have her upper trapezius muscle exposed. And basically this is the large muscle at the top of the shoulder right here. It runs all the way across the top and goes all the way up and inserts into the base of the skull right here. Now the muscle fibers are running basically this way, just like this. Now, if you were to move your hand across the top of the muscle, a lot of people, you would feel this little tight band within the muscle. And if you kept following this tight band, you would get to a point where you find a little knot, which she has one right here. Now, this is what we typically call a contraction knot. So you can think of this as a mini muscle cramp within the muscle. It's not the whole muscle, just a few of the fibers that get stuck together in this little contraction knot. Now, every muscle has a specific referral pattern, meaning that if she has a little trigger point right here in this muscle, it refers pain into a very specific area. This particular muscle refers pain into the base of the skull, along the side of the head, and into the front of the head. This is a very common muscle that we see for people who have headaches. Now, these can be treated fairly easy with specific techniques that we utilize in the clinic. Some of these techniques are called intramuscular manual therapy or dry needling. We can also use just manual pressure techniques to alleviate these trigger points. And then we give people a series of stretching exercises, and you talk and educate people about ways to avoid getting the trigger point again. So, to recap, a trigger point is just a little knot within the muscle that's not the entire muscle, it's just part of the muscle fibers that get stuck together in a little contracted knot. They have very specific referral patterns, and you can treat these to alleviate headaches and pain anywhere in the body.